everyone, great to have you tuning into this series of the Industry Talk. And in this episode, we have Dr. Tan Yuan here with us. To introduce, Yuan is a family physician with a strong focus on primary care, aesthetics, and medical technologies. He has a deep desire to leverage on technology advancements to optimize patient care, transcending conventional boundaries in the healthcare landscape. His ambition is to improve regional quality of healthcare and access to healthcare services. So Yuan, perhaps you want to start off by sharing more about yourself, your passion, and why you joined this industry.
Hi Zatalyn, thank you for the introduction. Okay, I actually joined this industry by default when I graduated in 2012. That's about 8 years ago. So I've since focused my career on primary care, which is I'm a family physician by training. I run an aesthetic clinic as well, and I also run a family medicine clinic, as well as I have an interest in medical technology, particularly in the industry of artificial intelligence, especially in healthcare. So healthcare is something that's very attractive to me since when I was in secondary school. That was why I decided to choose to be a doctor. So I think it's an industry whereby whatever you do can impact on your patients and improve healthcare of the public, the patients, and whoever that you come in contact with. So this is an industry that I feel that is meaningful, and I think that there's a lot of room for further development.
Alright, so being in the healthcare industry for the past 8 years, how have the delivery of health services changed?
I think the delivery of health services has changed a lot over the past few years, especially in the last 2-3 years, accelerated by COVID pandemic. So, I run a GP clinic, so all along, brick and mortar GP is you set up a clinic, patients come to you. So with the advent of technology and all, we are doing more of telemedicine, like doing consultation like what we are doing, for example, video consultation, whereby I can speak to you, discuss about your condition, and we have treatment, like delivery of medicine to you. We do incorporate mobile payment as well. So this is across all industries, that every industry is undergoing disruptive or definitive transformation, even in healthcare. So we need to change our concept of healthcare services delivery, maybe more community-centered, delivering to the patient's doorstep rather than a more passive way of waiting for patients to turn up at your doorstep. So that is what I feel that is the difference over the past few years.
From what you see for now, what is the future of this healthcare industry?
Healthcare industry is quite unique. It's an evergreen industry. So it's not so cyclical. It's not like oil and gas or, banking or whatsoever. So we are always in need of healthcare, especially in the region. Singapore is an aging population. I think everyone's know that. In the region, we have Indonesia, Malaysia, all the middle class, growing middle class with a growing desire for better healthcare. So I think within the region, there is going to be a deeper need for quality and better access to healthcare. What is in the future? I think healthcare is going to transcend borders, especially even though with travel restrictions, but provision of healthcare might be able to transcend between national boundaries. For example, teleconsultation potentially can be done across countries. And I think more and more artificial intelligence will likely be incorporated in healthcare. Previously, I was working with a medtech company as well that does the development of a chatbot whereby you key in your symptoms and it will tell you what's the likely diagnosis that you have and when and where should you seek help with. I think more and more of all these AI incorporated products or telemonitoring will be the future of healthcare.
Just now you mentioned something that really stood out to me, which was using AI to quicken the process of patients and doctor consultation. How accurate are these
So a lot of times, all these products, they do have a black box label that says they are not used as a diagnostic tool, more as like a advisory tool. So at the end of the day, the machine learning component is training the model. As it gets more and more disease incorporated in it, more and more patient profile that's being tested through the model, it gets more accurate. So at the start, it's probably more algorithm-based training, whereby you train the product and then it follows the algorithm and tells you what is the likely differential diagnosis. There are some studies out there that shows some kind of non-inferiority compared to a doctor's judgment. So for example, for myself, with like 9 years of experience, there's a limit to how many years it takes to train a doctor and how long the doctor can continue to see the patients before they retire. Whereas for the machine, you can actually keep building on. The memory space can just keep on increasing, and they don't retire. So the amount of knowledge that is under the algorithm can be built over like 100 years or beyond. So in time to come, potentially, with the neural network and all, they might be able to diagnose very accurately based on clinical inputs. But that's something that's very exciting as well. Yeah.
Some people have been saying that AI might be replacing doctors in future. How true do you think that is? There's definitely a sense of human touch that robots can't bring to patients, right? Yeah. So what are your thoughts on this?
So there have been a lot of talks, and doctors are worried about AI replacing them. I think we look at it more as AI augments or assists our role in caring for patients. For example, like just now, the disease symptom checker that we're talking about. So for example, if patients can actually key in like what symptoms they do have even before arriving into my consultation room, then we do have some preliminary data to work around with. Like for example, I already know that you have diarrhea for 3 days, vomiting for 2 days, fever for 5 days. So all this data can be presented to me. So when I see you, I can assess and I can maybe focus more on the physical examination, which the AI doesn't really do at this point in time. So we can focus on the things whereby the skill sets of the doctor can be more utilized. So whether it really replaces the doctor, not yet, not at this point in time. Hopefully not as well. Yeah. So even for like radiologists, we always thought that the AI will just come and report the scan, and then the radiologist will not have to report anything. But that's not exactly true as well. So the AI basically picks up areas that requires more closer attention, whereby the radiologist can actually focus on those areas. So instead of reporting 10 scans a day, now maybe the radiologist report 50 scans a day. So basically it draws attention to where it's wrong, and it allows the doctor to do more like collaborative work, speak to the pathologist, speak to the clinician, discuss with them rather than like purely reporting scans. So at this point in time, I think AI in healthcare is still relatively young. So we hope that in the future it can assist us in our delivery of even better care to more patients. Yeah.
When people actually talk about how robotics are coming to our life and how they might be replacing jobs, honestly, personally for me, I don't feel like it's more like a replacement job. I think it's more like how can we do better in our current situation? How can these technology actually help us, right? Alright, I have a question here for you. So when we talk about like human life, right, there are definitely ethics and regulations that comes into concern. And other than this, like ethics and regulations, right, what are other parameters that startups might, mislook when trying to start something in this healthcare sector?
I think whatever that we come up with definitely have to be ethical. Like as a medical product, it still follows the key principles of doctoring, like do no harm to the patient, brings benefits to the patient. I think from a startup or product development perspective, it's important to identify areas of need where is the need exactly, and then is there a role for AI to fulfill that need, rather than reverse the thinking, like I want to implement AI, and then like I just want to implement something, but whether it's useful or not to the stakeholders, then I'll think about it later. Yeah, I think we should put the horse before the cart. Like, this is something that I think that current healthcare system is not able to address very well. So these are areas that is very labor intensive. Can we come up with a solution whereby we can help to reduce manpower usage and all that, and then we work out, is there a role for AI to come in and then to help to facilitate the whole process, rather than reverse. So it's just like I just walk around with a hammer and then looking for nails to hit.
So personally, what are the white spaces in the healthcare or life sciences industry that you feel that entrepreneurs should focus on solving through technology?
So the current, a lot of attention, biomedical science and all, is on vaccine creation and all, but that's more for COVID, right? I think that's a bit more shorter term. So how we look at things is probably look at the whole demographics and the healthcare demand. So in terms of aging population, what are things that we can do that can actually help, and there's a use case in the future as the population gets older. So for example, I know of developments such as they're using AI to put on, to wear, and then they can check for retinopathy, like eye diseases. So similarly, products that can test the food sensation. These are things that can be used on a very big scale, like elderly, patients above 50 years old, 60 years old, you can do the testings, or remote monitoring, like using sensors to remote monitoring of patients with checking their gait, their walking stance and all that, to look for early signs of Parkinson's. So I feel that as the population gets older, I think these are areas of needs that we need to address, and will probably be areas that will be of interest to future investors and developers.
So actually, there's a large area for startups that actually come in by doing these, like, I wouldn't say gaps, but more like how can we do better, like questions. Like,
Yep.
Yeah. All right. So I have the last question here for you. Why did you choose to come on board with NAV Investor Talk?
I was an alumni of NUS, so I graduated in 2012, like what we spoke about. So it's just second nature to contribute back to NUS. Like, I'm always happy to take on like students, budding entrepreneurs, and give some like ideas and guidance along the way. So it's natural to contribute back to NUS Angel Ventures.
Thank you so much, Yuan, for taking your time off to have this new sharing with us. Right, if any of you have any other more questions, feel free to send me your questions to our email address right here. And also, do connect with Yuan on LinkedIn and reach out to him should you have any questions that you want to directly ask him. So we have come to the end of this session, and we'll see you again. Thank you.
Thank you, Zatalyn.